on yourself.
I am.
Friends.
There you go. Go.
All right. My name is Jimmy Hutton. This is my second speech. The speech is on. I have some visual aid this time. If you guys have something to look at me instead of watching me stutter. The speech is on how to prepare a SOAP note in physical therapy. The reason I chose physical therapy, I was a physical therapy assistant in the Army. Okay. The definition of physical therapy note is a format for the therapist to document a patient's treatment and session. Like if a patient was to go in, they hurt their back, they got their back adjusted or their back popped, a heat pack, a cold pack, any manipulations, you have to document that. So that's what the note is for. So when he goes back to the doctor says, I see he has 6 weeks of physical therapy, hot pack, cold pack, electric shock. Okay, there's 4 things in a SOAP note. There is the subjective, what the patient says. If the patient says, oh, my back hurts so bad, it's like, what is a pain scale? From 0 to 10, 0 being nothing, 10 being excruciating, and then that's how they think. Like, oh, it's like 10 out of 10, or 1 out of 1. So that goes in the subjective part. The objective part is what I see or whoever's taking the note. So if I see a guy saying it's like 12 out of 12, and he's bending over picking up a box and handing me, I suspect it's probably not as high as he thinks it is. Also in the objective part is you do tests, like range of motion tests. Say you hurt your shoulder, I'll take and say lift your arm as high as you can. And if that's as far as you could go, that's range of motion. Should be up here, but if you just could go only there, the range of motion is at 90, not at 120. Then you got muscle tests. It's like, all right, pull as hard as you can. If you just like barely pull, that'd be 0 out of 5. It's on a grade of 0 to 5. So if you go from 1, or you just no inhibitions, that's 5. And then you have special tests like with pins and needles and muscle tests. It's like the real like muscle dystrophy and things like that. You have special tests that we don't do. Okay, the other part is assessment. And the part of the assessment, we draw all the conclusions to all the tests we've done. So for instance, if you have a cold, we'll take your blood pressure, we will give a CBC Chem 7, thyroids, all this, temperature, blood pressure, pulse, everything, and then we'll take all those tests and then make a diagnosis. And then you find like in physical therapy, he hurt his shoulder, so we'll find a treatment, a plan for them for that shoulder. So like say ice pack and TheraBand, like a rubber band, do this 10 times, flexion 10 times, extension 10 times, abduction, and that makes them stronger. So we'll pick out a plan to make their shoulder stronger. And again, that's in the assessment part of it. And then the last part is the plan. So this is the plan of care. It's like, what are we going to do? It's like the expected outcomes. Like in 6 weeks, we want him to be able to walk on his ankle without crutches. And how frequent the treatment is. So are we going to say we need to see you 3 times a week for 8 weeks? That's in the plan. And set a goal. It's like, well, I want you to be able to lift a 5-pound dumbbell in 2 weeks, 3 weeks, whatever the plan is. And then the manual therapy, actually what are you doing? Are you doing leg lifts? Are you doing toe lifts? That's the manual part of the therapy. And then therapeutic exercise, like jogging in place, or lifting your legs with weights on, or something to that effect. And in the SOAP notes, something that's very important in the SOAP notes is acronyms. Because if you put range of motion, it's easier to just put ROM. So when you're reading your SOAP notes, like, what's that ROM mean? It's a universe of just words like treatment, TX. So you put treatment for ROM instead of treatment for range of motion, you use the acronyms for it. Okay. Okay, go to the on. Okay, Okay, here's the abbreviations like XR, X-ray. Years old, like Y/old, years old. You got treatment, you have history of, which is HO. Flexion, fracture, diagnosis, follow-up, full weight bearing, like you put all your weight on your foot. Dorsiflexion means going up. And then abduction means going in, adduction means going out. So you need these abbreviations or you'll be writing forever. Some days you may have 10 patients in an hour. For sick call, you have to get these all done. That's the easiest way to do it, is abbreviations. And like I said, it's universal. The doctors know what RX means. Okay, I did a quick soap note before you got here, and I'm going to read it to you. It's like the subjective, a 35Y/30-year-old male, in parentheses, patient, CO, complains of right ankle pain. Patient states he was playing basketball and twisted his ankle. Patient also states a history of sprained ankles. So that's my S, of my soap. All right, next. Tests and measures. So I would take his ankle and say, push up on with your ankle, pushing up. So that would be DF is dorsiflexion. So it would be 2 out of 5. You just go 2 out of 5. And then I say push down as far as you can. That would be plantar flexion, which is 1 out of 5. You barely push it down. Then abduction, I say move your foot in as far as you can. And I put pressure on it, resistance. You can only do it 1 out of 5. And then adduction, see how far you can push your foot out. It was 1 out of 5. So that is my test and measures. And then also on the objective I put visual, swelling, and bruising. You know, his ankle all swelled up, purple. You would put ecchymosis and swelling and things like that. I don't think he has any ecchymosis. And X-ray negative for fracture. See how easy it is just doing those acronyms? It's so much easier. And okay, assessment example. Like range of motion. You put a down arrow, decrease of range of motion. It means he can't really do that too much. The range of motion, he can't really do that too much. And then on assessment, I'd also say I recommend him to go to physical therapy for 6 weeks. Okay, here's an example of the plan. It's like I got A and B. That means ambulation. Walking means ambulation. Training with crutches. So I would teach him how to walk with crutches, how to ambulate with crutches. Written and verbal training and exercise program. I would tell him how to do leg lifts and give him a handout to take home with him. I would discuss and make sure he knew what he was doing. Then I issued an ice pack, a compression sleeve, and a brace and crutches, where he could go home and be comfortable. Always, always sign your name, because it's not a legal document if you do not sign your name. So I just put Nurse Betty, PTA, and then signature. Always make sure you have his correct information. Ask him twice. So Joe Schmo, 1, 2, 3, 4, 5, 6, 7, 8, 9. Make sure you have the proper security number, everything. Whatever your clinic says you have to have. If you have to have address, social security number, company, platoon, whatever. That's what you have to do. And this is one of my physical therapy clinics I opened in Afghanistan. And I just wanted to make points of, this is my physical therapy clinic. This is Afghani physical therapy clinic. The United States built this. We was in a hut with some string. They built the ANA $3 million physical therapy clinic with 10 bikes and all the top of the line things, never used. They don't even know what physical therapy means. So a waste of fraud there, but it's like, look how nice this clinic is, and look how nice our clinic is. All right. Anything else? Thank you, everybody, for coming. Hope it wasn't too long or dry.